Ascending aorta that's coming off the left ventricle, which obviously you're not seeing here, and this is the arch of the aorta over here. The three vessels off the arch of the aorta are the brachiocephalic trunk or innominate artery, the left common carotid, and the left subclavian artery. This is your descending thoracic aorta, and off the thoracic aorta you have your intercostal arteries going into the intercostal spaces and intercostal muscles. Over here you have your pulmonary arteries in blue because it's deoxygenated blood, and over here the pulmonary veins in red because they're carrying oxygenated blood. Remember that the colors are reversed here. Every other thing is red for arteries, oxygenated, and blue for veins. Okay, as the aorta continues down through the diaphragm, we come down to the abdominal descending gastric, your splenic, and your common hepatic. The left gastric to the stomach, common hepatic that eventually is going to go to the liver and to the duodenum, and the splenic that goes to the spleen. Over here we have some adrenal arteries going to the adrenal gland. We have the renal arteries that come off the aorta that go to the kidneys. This here is the superior mesenteric. These two dots or openings over here are your gonadal arteries. This is the inferior mesenteric artery. As this continues down, the descending aorta bifurcates and becomes the common iliac arteries. The common iliac arteries then become the internal iliacs that go to the urogenital area, and the external iliac artery that comes down and passes down and eventually in the thigh becomes the femoral artery. If we look at some of your venous circulation on here, okay, we have the internal iliac vein, the external iliac vein that merge to form the common iliac vein. The two common iliac veins merge to form the inferior vena cava. The inferior vena cava gets branches from different parts of the abdominal pelvic region. Over here is the gonadal vein, okay, the renal vein, okay, and the adrenal vein. Now you'll notice one of the differences is that on the left side of the body, all the venous circulation here goes directly into the renal vein, and then the renal vein enters the inferior vena cava. On the right side of the body, everything enters separately. Here's the gonadal vein right into the inferior vena cava. Here's the renal vein right into the inferior vena cava. Over here, on this side, we have the hemiazygous system. And as we continue up now into the arm region, we have the cephalic vein. And over here, we have the axillary vein. Cephalic vein continues around and merges with other veins that you don't see here to become the subclavian vein. And the subclavian vein here is going to merge with the external jugular vein. This large one is the internal jugular vein. So we have the subclavian, the external jugular, the internal jugular. Also the vertebral would come in, but we're not seeing it on this model. And it forms the brachiocephalic vein. Brachiocephalic on both sides. And the two brachiocephalics form the superior vena cava. Okay. Again, this would be your pulmonary vein. Okay. One last thing on the model is the internal carotid artery.